with Chuck Scarborough. Live from Studio 3C at Rockefeller Center.
Now, when you go to the doctor's office or try to figure out which doctor to go to, are you confused, intimidated, scared, any or all of those? Well, now a brand new book can help you navigate the healthcare system a little bit easier. It's called The Take Charge Patient, How You Can Get the Best Medical Care. And joining us tonight is the author herself, Martine Ehrenclou. Welcome, Martine.
Thank you so much for having me.
Now, in this book, you talk about preparing for your visit to the doctor. How do you do that?
Very important. And it's equally important to prepare for the doctor's appointment so you maximize the time with the physician, but also to increase your self-confidence as a patient. So you gather copies of pertinent medical records, you create a list of your medications, dosages, over-the-counter medications, and you create a list of questions so you know ahead of time what you want to be talking with the physician about. And you also list your top 3 medical concerns to keep you and the physician on track.
Now, when you are trying to talk to your doctor, you may be talking to several different doctors about the very same problem.
Right.
How do you manage that care? How do you avoid misdiagnosis?
That is difficult. That becomes a diagnosis journey. But if you can get copies of all your medical records and each time that you go see the doctor, you bring those copies of medical records with you, and you create a health summary for yourself, and you get copies of MRIs, CT scans, that sort of thing. And you go into the doctor, and not like they are, just because they have training and experience that you don't have, they are not above you. You are working in partnership with the physician. So you come in with a list of questions and say, this is what one doctor told me and this is what the diagnosis was. I'm not so sure that's my diagnosis because I don't have 2 of the 5 symptoms. What do you think? Here are all my medical records. Here are my tests. How can you help me?
Another big thing for most people is insurance. How do you understand and manage your insurance?
That's very difficult for all of us and very time-consuming and frustrating. But the very simplest is to read the packet that you get, which all of us probably throw away or throw into a drawer. You can call the number on your insurance card and ask questions. Is this doctor that I'm seeing, is he or she covered by my health insurance? If not, what is my copay? Is this doctor out of network? You can find out all sorts of things. Is the hospital that I think I'm going to covered by my health insurance? That's how you find out the information.
Most people don't ask those questions until they are turned down.
Exactly right.
If you are turned down, how do you navigate that?
Well, you can go to your physician and ask for their medical billing office if they have one and enlist their help. There are a whole series of steps in my book that you can take, but you can enlist their help. But if you're turned down for something that's medically necessary, the doctor should assist you with trying to get that appeal approved.
Okay, thank you so much. It sounds like you have a lot of good advice in there.
Well, thank you so much for having me.